With over 3 decades of experience in cardiology, what troubles me the most isn't the severe cases I've seen in the operating room. It's the elderly patients who walk into my clinic wearing a look of exhaustion, with hearts out of rhythm. Not because of age, but because of something they believe to be harmless, the familiar pills they've been taking for years. Many of them don't realize that the very medications prescribed to ease pain, improve sleep, lower blood sugar, or stabilize mood are quietly weakening their hearts day by day. And the saddest part is that these damages don't make noise, don't give warning signs until it's too late. Did you know that certain medications legal, common, and taken millions of times a day in the United States can raise blood pressure, cause heart arrhythmias, lead to fluid retention, and even mask early signs of heart failure? If you or someone you love is over 60 and taking multiple medications daily, you deserve to know this truth. Not to cause worry, but to protect your heart properly, safely, and scientifically. Because your heart should never be the price you pay for the convenience of a prescription. I don't share this to scare you. I share it because you or your loved one have the right to know the truth. And sometimes, that truth gets lost between hastily written prescriptions, rushed follow-up visits that last mere minutes, or tiny drug labels we rarely read closely. My goal is not to make you stop your medication cold turkey, nor to make you lose faith in modern medicine. My goal is to help you better understand what's happening inside your body, especially now, at a stage in life when your heart may no longer be able to compensate the way it once did. If you're taking daily pain relievers, sleep aids to get through restless nights, diabetes medications to keep your blood sugar stable, or antidepressants to manage your mood, then this video is for you. Not because you've done anything wrong, but because your body at 60 doesn't respond to drugs the same way it did at 40 or even 50. I'm here to help you ask the right questions at your next doctor's visit, so you don't miss the subtle signs your heart is trying to send. And so you can continue living not just longer, but healthier, lighter in the way you truly deserve. Pill number 1, calcium channel blockers. The first type of medication I want you to pay special attention to, and the one I encounter most frequently in the health records of elderly patients, is the class of drugs known as calcium channel blockers. These are commonly prescribed to manage high blood pressure, treat angina, or address arrhythmias. Familiar names like verapamil or diltiazem may have been sitting in your medicine cabinet for years. Mechanistically, this group of drugs works by relaxing blood vessels and reducing the heart's workload. However, in older adults whose circulatory systems are already weakened and whose hearts have reduced adaptability, excessively slowing the heart rate can pose a real danger. You may experience prolonged fatigue, dizziness, swollen legs, or even sudden fainting spells that you might simply attribute to old age. What's even more concerning is that these symptoms are often mistaken for natural aging. This allows bradycardia or arrhythmias to progress until they result in serious consequences silently. I'm not advising you to stop taking your medication, but if you are using calcium channel blockers, take the initiative to ask your doctor, is this still the best option for me right now? Pill number 2, proton pump inhibitors, PPIs. Second on this list is a type of medication you may be taking daily and still believed to be completely harmless, proton pump inhibitors or PPIs. Names like omeprazole and pantoprazole are often prescribed to treat acid reflux, heartburn, or gastritis, all common issues in older adults. However, when used long-term beyond a few continuous weeks, this group of drugs can quietly cause internal changes that often go unnoticed. The sustained suppression of stomach acid can interfere with the absorption of vital minerals such as magnesium, and that poses a serious risk to your heart. Magnesium deficiency can lead to irregular heartbeat, fatigue, muscle cramps, and even general physical weakness. What's more, PPIs can disrupt the balance of your gut microbiome and increase chronic inflammation, a key factor closely linked to cardiovascular disease. My advice is very clear. If you've been taking PPIs for more than a few weeks, talk to your doctor about reassessing their use. Sometimes, the best thing you can do for your heart isn't to add another drug, but to adjust how you're using the ones you already have. Pill number 3, decongestants. The third item on this list may surprise you due to how commonly it's used decongestants, which often contain active ingredients like pseudoephedrine or phenylephrine. These medications are found in most over-the-counter cold remedies, spring allergy treatments, or nasal decongestants, and are widely available in pharmacies across the United States without a prescription. However, what few people realize is that decongestants work by constricting blood vessels to reduce swelling in the nasal passages, but they also constrict blood vessels throughout the body, including those that supply the heart. This can lead to increased blood pressure, elevated heart rate, palpitations, or even arrhythmias, especially in older adults with more sensitive cardiovascular systems. The issue becomes more serious when users don't realize that the body reacts very differently after age 60. A dose that seemed harmless at 40 could become a real burden for the heart at 70. So before reaching for a decongestant, the next time you catch a cold, take a moment to read the ingredients and consult your doctor or pharmacist. Don't let a tiny pill unintentionally push your heart into overdrive. Pill 4 antidepressants. The next group of medications worth highlighting is an older class of antidepressants known as tricyclic antidepressants, including well-known names like amitriptyline and nortriptyline. Originally prescribed to treat depression, anxiety disorders, and even chronic pain, these drugs are now gradually being phased out due to their unwanted effects on the cardiovascular system, especially in older adults. The problem lies in how these medications affect the electrical conduction system of the heart, potentially causing arrhythmias, heart block, or sudden changes in blood pressure. Symptoms like dizziness, irregular heartbeat, or fatigue are often dismissed as mere signs of aging when they could be warning signs of silent damage to the heart. But the risks don't stop there. Tricyclic antidepressants also increase the risk of falls by causing drowsiness, orthostatic hypotension, a drop in blood pressure upon standing, and cognitive decline, all of which are especially dangerous if you live alone. If you or a loved one is currently taking one of these medications, don't panic, but do be proactive in asking your doctor about safer alternatives. Today, there are many newer antidepressants with less impact on the heart and better suited for individuals over 60. Pill number 5, sleeping pills. Difficulty sleeping is one of the most common issues in people over the age of 60, which is why many turn to sleep medications from the sedative hypnotic class, such as Zolpidem, Ambien, or older tranquilizers like diazepam. These pills may help you fall asleep more easily in the short term, but when used long term, they can silently take a toll on your heart. The biggest risk with these drugs is that they slow down the entire central nervous system, including the regulation of heart rate and blood pressure. This dampens the body's response to physiological stress during sleep, increasing the risk of sleep apnea, a condition that reduces oxygen flow to the heart and can lead to arrhythmias or even stroke. Even more concerning, when combined with other cardiovascular medications like beta blockers, sleep aids can interfere with treatment effectiveness, potentially causing irregular heartbeat or dangerously low blood pressure. If you're relying on sleeping pills every night, take this as a gentle reminder to rediscover natural sleep through healthier methods, such as adjusting your lighting, improving bedtime routines, or exploring cognitive behavioral therapy. Talk to your doctor about options that help you sleep without harming your heart. Pill number 6, diabetes medications. If you're managing type 2 diabetes, chances are you've heard of or are currently taking a medication from the thiazolidinedione, TZD class, most commonly pioglitazone. These drugs are designed to improve insulin sensitivity and reduce blood sugar levels. It may sound ideal, but for those over 60, the benefits may be accompanied by serious hidden risks to the heart. TZDs work by causing the body to retain fluid, and this retention can lead to swelling in the lower limbs and, worse, increase the risk of congestive heart failure, especially in people who already have heart disease or high blood pressure. The danger is that symptoms like fatigue, shortness of breath, or rapid weight gain are often mistaken for aging or diabetes complications. This is not a warning to stop your medication immediately, but a reminder that diabetes and heart disease often go hand in hand, and managing one condition should never worsen the other. Pill number 7, anti-inflammatory drugs. Coming in at number 7, but no less concerning, are non-steroidal anti-inflammatory drugs, NSAIDs. including familiar names like ibuprofen, Advil, Motrin, and naproxen, Aleve. These small pills are commonly used by older adults to relieve joint pain, back pain, or inflammation, and often they're taken too frequently without proper medical oversight. The problem is that NSAIDs can raise blood pressure, cause fluid retention, and place added strain on the heart, especially in people with a history of heart disease or hidden heart failure. The sodium and water retention forces the heart to work harder, which may lead to fatigue, shortness of breath, leg swelling, and in many cases, trigger or worsen congestive heart failure. What makes this more dangerous is that the effects are not immediate, they creep in silently, and by the time symptoms become obvious, the heart may already be significantly weakened. If you're taking NSAIDs daily to manage chronic pain, talk to your doctor about safer alternatives, such as physical therapy, anti-inflammatory nutrition, or pain relief options that are gentler on the cardiovascular system. Your heart is a remarkable organ, resilient and powerful, but also more vulnerable as you pass age 60. The pills you trust every day may be valuable allies, but they can also be silent enemies if not properly monitored and reviewed. I don't share this to scare you, I share it to empower you, to give you the right to understand what's going into your body, to encourage you to ask the right questions at your next medical visit, and to help you live the years ahead with a heart that's strong, alert, and full of hope. If you found this video helpful, feel free to share your experiences or questions about any medications you're currently taking. My team and I are always here to listen. And don't forget to subscribe to the channel for more easy to understand, evidence-based advice, all designed with you and your heart in mind.